Hello and welcome to my podcast series, Dine with Doc. My name is Dr. Sanjay Arora, and my attempt is to bring you the latest in medical science and technology, where the attempt is to unburden healthcare. Today, we have the privilege of launching this series with a dear friend, Dr. Sandeep Sattur. So, hi Sandeep, and welcome to the podcast. Thank you for joining me today. It's a privilege to launch it with you.
Thank you, Sanjay, for having me here.
It's great. So let me introduce Dr. Sandeep to all of you. Dr. Sandeep Sattur is a visionary plastic surgeon dedicated to revolutionizing hair restoration. He has over 2 decades of experience. In fact, his first transplant surgery was way back in 1998. Since then, he's become a pioneer in techniques like follicular unit micrografting, transforming countless lives affected by baldness, trauma, and burns. Dr. Sattur's impact extends far beyond the operating room. He's a staunch advocate for patient education and evidence-based medicine, ensuring every individual makes informed decisions about their care. Sandeep has been part of cutting-edge research like the human platelet lysate to topical solutions for androgenetic alopecia. He's a member of the training programs and prestigious speaking assignments. He's shaping the future of hair restoration. Dr. Sandeep isn't just changing hairlines, he's changing lives one follicle at a time. Thank you again for joining, Sandeep.
Thank you, Sanjay, for those words.
So tell me, Sandeep, you and I go back 40 years. We started our MBBS together in Grand Medical College. I think let's start with a cup of tea and coffee because it's Dine with Doc. So thank you again. Amazing how a single hair follicle has so much of biology, science, and now technology as well in it, right?
It's a micro universe, I would say.
Micro universe.
In fact, if you look at this follicle, it is one of the organs that comes from 2 germ layers, which has different meanings.
Right.
And it is the signaling between these 2 germ layers throughout life that maintains the follicle to produce the hair at a regular rate. So it is this signaling that is there existing in our body, which is nothing short of magic.
Wow. Maybe let's take you and me for example. You have still a full set of hair. I have none. So maybe you could just, for the benefit of our audience, many people think that, if it's there in the family, almost everybody else will get it. So my father was actually bald when he turned 30 and I started losing hair around maybe in my mid 30s, maybe early 40s. So I know genetics definitely plays a role. But maybe you could just explain to our audience how much of genetics is really the root cause, and is there any other reason like lifestyle or hormone changes or medications? What's been your experience of the real root cause? Let me say root cause because it's follicle. What's the reason of hair loss?
It's like this. When you look, when the initial understanding of this problem was looked, in fact, way back from the time of Socrates, this has been understood that genes do play a role because he was the first guy to actually say about these things. But initial approach to the problem was linked on individual genes, which kind of skewed the whole information. So the first gene isolated was found to be on the X chromosome,
right?
And you inherit the X from your maternal side,
right?
And one thing is for sure, the inheritance is more direct when you have it from the maternal side of the family.
Right.
But you have lineages where the grandfather, father, or son are also having the same. So there was no gene to explain that part of the story.
Right.
It's only when the genome-wide studies got published or, started looking into it,
right,
we realized that today we have more than 600 genetic components or loci which could have a bearing on the way the follicle behaves.
600?
Yes, more than 600.
Wow.
And there is a huge number of permutation combinations of various genes that interact and finally result in what we see as the male pattern or female pattern hair loss.
Right.
The genetic antecedents in the female pattern hair loss are not still clear. We have still slightly better knowledge about the male pattern hair loss, and that is why you see it more clearly that it runs in the families. In female pattern, you may not find that direct connection.
Right.
Secondly, the understanding of this genetic loci has to be kind of looked at with epigenetic influences.
Of course.
Now, epigenetic influences will tweak the way your individual genes behave.
Right.
So these may not totally negate the genetic influence, but they can prepone or postpone the actual occurrence of the hair loss. This is my understanding from a clinical perspective.
I think let's maybe explain to our viewers what is the meaning of epigenetics, that you are born with a genetic code,
Yes.
and it gets expressed or not based on our lifestyle, on the influences our genetics or our genes have because of the lifestyle that we live. Is that correct?
Yes, it is like the genotype, that is the gene that you inherited,
Right.
and phenotype is the expression. So these two can change with epigenetic influences. So when we say epigenetic, it is from the time you are in utero till you are an adult.
Correct.
There are various influences. It can come through lifestyle, through environment, through your diet, through your exercise.
Correct.
So a lot of things. Like if you are smoking has been found to be a very big factor in preponing the onset of hair loss in genetically predisposed individuals.
Okay.
So that is going to be a factor.
Sure.
So similarly, if you see the kind of obesity we have in the younger age group,
Right.
and that comes primarily from a nutritional excess which is there. Now, nutritional excess doesn't mean that you're eating healthy food. You're eating more calories.
Right.
So the follicle can get stressed in situations of nutritional deficiencies as well as in nutritional excess. Both can cause stress to the follicle. So this is where the epigenetic influences can change the way things behave at a follicular level.
I guess this whole instant gratification that you get, because of everything coming at home, this whole ultra processed food that you get has a lot of calories, but no real nutritional value.
Yes. The problem about pinning the fault on one particular thing is very difficult because there are so many variables that come into play with individual person.
Sure.
So there will be so many variables. So for any study to delineate and say that this factor is responsible and you can change this, that is not possible.
Right. I think since you brought up food, let's maybe grab a bite.
Yes.
It is a dine with doc. But besides food, maybe you have the biscuit and you can tell me what else do you think, genes, epigenetics will explain. What else are, in your experience, one of the common causes?
For that, I would like to elaborate on the fact as what are we talking about? We're talking about hair loss. When we talk about hair loss, we need to understand what has happened to the follicle. So primarily, we divide hair loss into two types. One where it is associated with scarring, and one not associated with scarring.
Okay.
So there is a scarring hair loss, which is also known as cicatricial hair loss, and the non-scarring hair loss. So the common baldness that you see in men and women is the non-scarring variety.
Sure.
So if you look at the scarring hair loss, there has been an injury at the level of the follicle.
Okay.
And that has directly damaged the follicle, and the follicle cannot produce a hair shaft.
Sure.
So that is one thing that has, the cause is there.
Right.
So these are primarily autoimmune conditions.
Okay.
Where an inflammation happens around the perifollicular region, and that causes scarring there, and the follicle stops producing the hair shaft. If you look at a non-scarring hair loss, the follicle totally does not stop producing the hair follicle. It produces a follicle of a very fine caliber, which is not visible.
Okay.
So in terms of scalp coverage, if you look at an example, let's say this is the surface that is covered by, let's say, 20 tennis balls.
Right.
That is your youth.
Okay.
And the paper underneath is not seen.
Right.
You're approaching male pattern hair loss. At the end of maybe say at 35 or 40, there are still 20 balls, but 15 of them have become table tennis balls, and a few of them have become marble sized.
Okay.
So what that means is the paper underneath is visible.
Right. Okay.
And that is what happens in pattern hair loss.
Male pattern body.
Male or female.
Male or female.
The endpoints of both these are same.
So meaning the thickness of the shaft, the hair goes up, just becomes less.
So roughly what is 100 and 120 microns can go down to 20 microns, which is not visible to the naked eye. Okay. So what happens is at a particular point, these follicles can become fossilized. Then they are not capable of producing any hair. That is the very late stage of hair. So when you look at it from this point of view, scarring, we know the cause. In the non-scarring, there is patterned hair loss and there is unpatterned hair loss.
Right.
So patterned hair loss is something where certain areas of the scalp are preserved through life.
Okay.
So if you see a horseshoe-shaped area on the back of the head and side of the head,
Right.
these follicles remain throughout life.
Right.
On the other hand, the areas that are affected, the frontal, mid-scalp and the crown, are lost.
Yes.
Means these are the follicles that become thinner. These retain their caliber till probably the very end.
And that's the most common pattern.
That is the common pattern of hair loss. One of the studies, interestingly in men, looked at it. They biopsied areas where the balding was there,
Right.
and they biopsied the areas where there was no balding. As a control, they had individuals who had no balding.
Right.
So when they did the assessment, they found that the expression of specific pointers like the 5-alpha reductase enzyme,
Okay.
the androgen receptors, was much higher in the balding follicles as compared to the non-balding follicles
Okay.
in the same individual.
Oh, okay.
And also, when you compare the same area in a person who's not lost any hair, you will see that the expression is much higher than those people also.
Right.
So this tells us that there is a pathway that is mediated through the androgens. So one of the early indicators of male pattern baldness was thought to be the androgens
Okay.
in genetically predisposed individuals. Now, other types of non-scarring hair loss commonly is alopecia areata.
Before we go to that, I mean, so in females, when we do a PCOS profile, is the androgen at play there also for females?
Yes, it can have a role. Now, what happens is in women, biochemical and clinical evidence of hyperandrogenism may or may not be there.
Okay.
So what we do is that we will assess the levels of the hormones.
Okay.
They may be normal,
Right.
but what happens is if they have higher level of androgen receptors, even some normal levels of hormones can have an androgenetic effect.
Okay.
Very small percentage of patients, it will be on the higher side. But these hormone levels fluctuate with a lot of factors. Activity, especially physical exercise, there will be a change.
Right. So the insulin resistance plays a role in that case.
Insulin resistance is what epigenetic influences will be a factor.
Okay. Okay.
That is where it comes.
Where it comes into. Okay. Okay. You mentioned alopecia areata. That's the autoimmune disorder that you mentioned. So that would be a medical condition which is causing hair loss, right?
Yes, I would say that is a pathology.
Pathology. Right?
Male pattern and female pattern hair loss are basically genetic factors playing out their role.
Sure.
But here it is a pathology at work, and it can affect anywhere between 5 to 7% of the entire world's population.
That much.
It's because many times you don't realize that you had the patch and it has regrown. It is one of the most unpredictable conditions to treat.
And that can happen in any age?
It can happen in any age.
A young child, that
Yes.
girl that I had referred to you,
Yes.
hardly 7 or 8 years
It
old.
can happen in much younger than that child also.
Okay.
And then there have been studies which have looked at triggers for this. Febrile episodes have been very common triggers.
Okay.
And also psycho-emotional stress.
Okay.
These are two triggers that it's when we look at patients who come to us, history taking will have some role to play as to just to try and understand what are the triggers. Why did it start at a particular time? I give an example to all our patients. They always ask for supplements, when we are treating them.
Sure.
And if I find all their levels being normal, they are having adequate diet, they don't have any digestive issues, there is no need to supplement, because there have been enormous number of studies. They have done studies in sheep to try and improve the quality of wool that they want.
Right.
They have done it in horses, they have done it in canines, they have done it in humans.
Okay.
No study has conclusively said that by using nutritional supplements, I'm able to augment the hair, unless there is an underlying deficiency.
Sure.
So when it comes to hair as a structure is almost 90-95% protein. So, there are diseases, kwashiorkor, marasmus, where calorie and protein, energy malnutrition that is there.
Yeah.
They will cause a change in the hair morphology, but rarely cause hair loss.
Yeah.
So an example is that you look at the street side people, who are from a very poor socioeconomic strata.
Right.
None of them will have baldness as such. If nutrition was such an important cause, I would look at them having a significant amount of baldness. They don't have. You'll see that their hair becoming lighter in color. You see, most of them will have light colored hair.
Right.
That is typical of protein and iron deficiency.
Okay.
Correcting that will go a long way in helping these patients. So, every patient of male pattern or female pattern hair loss, I do screen them for these things.
It's more the quality of hair rather than the quantity of.
Yes.
Interesting. And in your experience, whenever you see so many patients, anybody who's affected because of medication that comes to you, like, chemotherapy or such medications that cause hair loss, and they come to you because of that?
Most chemotherapeutic agents, the hair loss caused by them are reversed. There is no issue.
Right.
Some of them, for some reason, which we don't know the reasons, this cannot be explained today with our understanding. Whatever we have, why does this change happen?
Right.
But there is a change. So treatment-wise, I don't say that there is any treatment because it is a self-limiting and reversible thing.
Right.
So you have to tide them over in that period. So using a replacement hairpiece or a hair system is the best. The best thing for female patient is to tonsure the head.
Right.
And start using the hairpiece before she actually loses the hair.
Okay.
That goes a long way in maintaining their self-confidence, self-esteem, body image, and they retain a little bit of positivity when they're going through this, troublesome period of chemotherapy.
So maybe the oncologists could take account from.
Yeah, they do that.
Right. Let's take a pause here and maybe, bring in the next layer of snacks that we have here from Dine with Doc. Can we do that? Yeah. Thank you. As we enter the next section, let's enjoy some puri idli.
Yes.
I know you are very fond of cooked snacks. So we thought maybe this is a good healthy snack.
Thank you.
What's your take on the puri idli?
Nice.
Want to try some chutney as well? Yeah. I read somewhere about this condition called Androgenetic alopecia, where it said 50% of the males get some form of baldness by the time they are 50, and 70% almost by the time they are 70. And 40% of women also see some form of hair loss by the time they are 50. What can people say that, okay, this is expected to be normal? When should they be alarmed that this is more than normal hair loss? And how do you sort of advise males and females to look at hair loss differently?
So let's first bifurcate the issue. Hair loss and hair fall are two different entities.
Okay.
Hair loss, like I said, is where the caliber of the hair shrinks and the scalp becomes visible, or there is destruction of the hair follicle and the scalp becomes visible. That is one entity.
Right.
Hair fall is when you actually shed the existing hair. Now, to understand hair fall, one must understand the biology of the hair follicle.
Right.
And the hair follicle is an organ which goes through periods of growth, periods of involution, and periods of rest.
Right.
Now, if we look at the follicle, it has a byproduct by virtue of its metabolism, which is the hair shaft. Now, it has a growth phase which can last anywhere between 2 to 8 years.
Okay.
So during this phase, there is constant activity going on which is producing the hair at the rate which is normal. Roughly about a centimeter of hair grows every month.
Okay.
So suppose somebody has a growth phase of about 2 years. So that is 24 months. So the length of the hair will never be over 24 centimeters.
Right.
Give or take a few centimeters, but nothing more than that. Somebody who has 8 years of growth phase will have much longer hair. So that is why you see the discrepancy in people. It's like somebody is like a clone of Rapunzel and somebody is not able to grow hair longer than the shoulder length.
Right.
Even if they don't cut it. So the growth phase, once it is over, the follicle goes into an involution.
Okay.
Where it stops producing the hair shaft.
Okay.
And after this, it goes into a rest phase, which is about 2 to 4 months. Somewhere in this period, it sheds the old hair and it goes back into the growth phase and starts producing a new shaft.
Okay.
So understand this, that out of 100,000 hair on our scalp, about 90% are there in the growing phase at any given time in most individuals.
Sure.
So that means 10% will be in the resting phase or involution. By that token, shedding 50 to 100 hair every day is normal.
Right.
It is not an issue.
Right.
We wrote a paper on COVID
Right.
and its impact on hair.
Right.
So in COVID, the level of inflammation was much higher than in the routine viral infections. And that is why people with especially the long COVID types would have had hair shedding for a much prolonged period of time.
Okay.
And we did see a larger number of people complaining of hair fall.
And people, because they don't connect the two dots, think perhaps, oh, I changed my shampoo,
That is what.
or the water in the taps had changed. The shampoo or water.
This thing is very interesting. Now, I was working in Mumbai. I moved to Bangalore. I moved to Chennai. I moved to Dubai.
Right.
And I'm having severe hair loss. Now, one thing is that look at the age of the patient. Generally, they move in their 20s. Common.
Right.
Either for education or for work.
Right.
And that is the time the natural progression of the male pattern hair loss is going to be there. That is one part.
Right.
Water per se in that same individual will not have an impact on the beard or mustache. Why is it having impact only on the scalp? And it's something to be thought about. Moreover, there were 2 papers published. There was one paper from Bangalore which said as a conclusion that there is no correlation between hair fall and the mineral content of the water. See, hardness and softness of water is basically upon the mineral content.
Sure.
And the other paper looked at hair in men, which is very surprising because the length of the hair is much short. And they talked about breakage, not hair fall, but breakage. Now, these are different things.
Right.
One has to look at this before generalizing and saying that water is bad and this happened. Similarly, shampoos are got no role to play in the amount of hair shedding that happens.
Okay.
Which I personally haven't come across any literature that actually connects change of shampoo or conditioner. See, more than the shampoo, you'll see a common myth that using conditioners causes hair fall. Again, that has not been substantiated.
Dandruff doesn't have any role to play.
Dandruff will not cause hair fall.
Will not cause hair. No, this is a great point because people should know the difference between hair fall and hair loss, and not they are not
the same thing.
Right, absolutely. No, that's great. That's great. Let's move on, and I think we should talk about treatment options, because I think that's going to be the large part of what our discussion should be. So I know there are medical treatments and then there are surgical treatments, and I know with your experience, and I've witnessed that with patients also, that how you take the patients through the entire spectrum of what to do and what not to do. So how do you decide on educating patients on what is the right treatment option and what are the various options that patients should be exposed to?
Basically, the primary thing is for me to understand the type of hair loss that the patient is having and convey it to the patient. So first thing that I would say is to diagnose the problem.
Right.
So there has to be an element of patterned hair loss. There has to be some part of the scalp that is known to be preserved, should be in good condition, and some part of the scalp that has been affected, which will have the miniaturized hair.
Right.
Now, having done that, once we have come to our conclusion that this is the diagnosis, then you explain to the patient that there are 2 aspects to a problem. Now, I have personally felt this and I have told this to the patients that there are 2 aspects to their problem. One is a dynamic aspect and one is a static aspect.
Sure.
Now, if a person has come to me who has lost the frontal part of his hairline and he's got some amount of thinning at the back, but the rest of it is intact. Now, his static problem is the one that has impacted his facial features, where the framing is lost. See, this frames your face, correct? So this framing is lost, and that thereby the youthful proportions of the face have been impacted.
Sure.
So that is one part of the problem that will be addressed by creating that landmarks again.
Right.
But I may create the landmark, but the rest of it will continue. So the dynamic part of the problem is it is going to progress with age.
Right.
And unless we deal with that as well as the front, you'll not have a holistic kind of a solution to the problem.
Sure.
So when counseling patients, I tell them that each of these aspects will be dealt differently. The first aspect, which is visible, which is impacting the facial aesthetics,
Right.
will need surgical restoration,
Sure.
where we will have to create landmarks that have been lost.
Reframe the phrase.
Reframes the face, yes. And the second part is to prevent the existing hair from becoming worse.
Sure.
So to prevent that, we need to use certain medication.
Right.
Now, using this in combination has always helped patients.
Okay.
Now, there may be patients where the hairline is intact, but they may have hair loss only in the crown.
Correct.
And that is also the known pattern of hair loss.
Right.
In such patients, the emphasis will be more on the medical management initially,
Right. Right.
and then come in with the surgery
Sure.
at a later date.
Sure.
All patients should understand that if I am surgically doing something at, let's say at 30 years of age,
Right.
creating a hairline and everything, that doesn't mean that is the only surgical treatment you will need. You may need surgical treatment later on when there is progression of hair loss,
Sure.
which may come 5 years down the line, 10 years down the line. We don't know when,
Right.
but it can come in. So this has to be a part of the counseling, because patients should know that this will have a repeat value
Right.
in terms of the surgery.
Right.
So they should not think that it is a cure, or instead of doing the medicine, I am doing surgery. It is not one or the other. It is always both,
Right. Right.
if at all it is to be done.
So let me just ask, in your patient population, what is the male to female divide? I mean, what percentage of your patients are male and what percentage are female?
Means you are asking from a surgical perspective or just the
Overall.
See, I would say in the clinic, it would be somewhere between 65 to 70% being males and 30 to 35 being females. But when it comes to surgery, it will be almost 90 to 95 males and 5 to 10 females.
Okay, because I would have thought that this is almost an optional intervention. For example, I could have chosen to do something about it, or I can not do anything about it. Whereas in females, perhaps the choice is less, because aesthetically or cosmetically, it will make a bigger impact on a female than a male. But you see a significantly higher number of male patients coming to you.
Yeah, the thing is that in female patients, the pattern of hair loss is such that it is easily concealed by their existing hair.
Okay.
So camouflage, simply by changing your hairstyle, can tide them over a decade
Okay.
without any problem.
Okay. Okay.
But in men, that option is not there. The moment you go in for a comb over, you can spot the hair loss.
Right. Right.
So that is where the difference is. Moreover, female hair loss is coming on a little later, maybe almost by a decade,
Right.
when it starts to manifest in the real sense.
Sure.
But over the last maybe decade or so, we are seeing school-going children presenting with fully defined male or female pattern hair loss.
Really?
So this is something that is not initially I used to think because people are more aware because of social media, and that is why they are presenting to the doctors at an earlier age. But that is not the case, because even in earlier practice, I haven't seen children in their early teen having this problem. And though there is a factor that they are more aware.
Right.
Today, at 13, 14, children are aware of hair care products, they are aware of cosmetics, they are aware of so many things.
Correct.
And body image plays a huge role in their lives today than what it was 5 decades or 4 decades ago.
True. Right. Interesting. Because I'm just thinking to myself that is it the kind of lifestyle? Is it the kind of diet? Is it the lack of exposure to sunlight? As you said, vitamin D is an important element that is causing this to happen. And also added to that, a lot of younger children or younger adults I've seen with premature graying of hair. Maybe you want to just touch upon that as well.
See, epigenetic influences that I said,
Right.
children today are consuming a lot more processed or ultra processed food as compared to maybe 3 decades or 4 decades ago because of easy availability.
Right.
And moreover, it is fashionable. And the lure of processed food is far, far more than what the conventional food.
Tastier.
Yes. But it cannot be blamed only on this one thing. It could be a factor, a very important factor.
Right.
But it would be the whole lifestyle. You see, the exposure to the blue light
Sure.
is a big factor. Their days are not synchronized with the sun, or day or night, I would say.
Correct.
They don't sleep at the hours when we would sleep.
They don't follow the circadian rhythm.
Yes. And that, I think, is a bigger factor. Because melatonin is definitely impacting the hair fall.
Melatonin, which is responsible for the color.
Not only the color, it is impacting the hair growth cycle.
Sure. Okay.
So these factors will play a role. So sleep, activity, diet, and the amount of stress that they have is, when we were in school or college, either it would be the studies that would bother us in terms of stress. Today, the number of friends that they are, liking, not liking, those kind of things are playing havoc in the child's mind.
Correct.
And that, see, I would not say a big point and say,
Right.
but in my mind, these factors could be playing a role.
Right.
At present, nobody can say for sure as to where the problem lies, but I would look into these factors also.
Again, I think the importance of a good night's sleep, sleeping at the right time, waking up at the right time, exposure to the natural environment, such a big impact even on hair.
Exposing yourself to the sun,
Right.
playing like we used to play in our childhood. You don't see that.
People are playing games only on the computers and not outside. True.